talking to Mr. Ali. He's the father of Sarah. Sarah is 4 years of age, and he came to you because she is having a complaint of short cough, fever, and shortness of breath. And this is the fifth attack of pneumonia in last 6 months. She's also having uh, failure to thrive.
Okay.
Okay, so need time.
Yes, I can start now.
You can start. Let me then take the paper. Okay, halas. Okay, start.
Hello, good afternoon. My name is Dr. Wayne, and am I talking to Mr. Ali?
Yes, thank you, doctor, for being here.
He must be the dad of Sarah.
Yes, sure.
Nice to meet you. How may I call you? Is that all right to call you Mr. Ali?
Yes, that's fine.
Alright. I'm here to ask history regarding Sarah condition. Is the time suitable for you?
Yes, ma'am. Yes, doctor. It is really appreciating.
Can you tell me what's happened to Sarah?
Yes, doctor. For few days, he having the complaint of his cough, fever, and shortness of breath.
I'm sorry to hear that. Can you specify for me? When did it start exactly?
Actually, it is the very sixth, in fifth time this is happening in the last 6 months. That is why I'm become very. I don't know why it's going on. But this is time about 4 or 5 days before she started cough, fever, and shortness. All things came together.
All right, it must be quite frustrating, I can see. Is the cough is wet one or dry cough? Can she
It is
bring the
just
phlegm?
it is just a cough, doctor.
Can she bring the phlegms?
She no, she's 4 years. She is still not capable to make it out.
Okay. And is there any particular time that she cough a lot?
Doctor, she's coughing all the day, but I notice she is coughing mostly in the night time.
Mostly in the night time. Anything in particular make the cough worse? Anything in particular trigger the cough?
Mm, no, doctor, I didn't notice any such thing.
All right. Have you tried anything to relieve the cough, or is there anything that made the cough a bit relief?
Yeah, just going to the nearest GP. He has been giving some nebulization and some medication, but I think it's still not working very well. Just he gets some relief for some period of time, but again, this is happening.
I can see. Do you notice any noisy breathing along with the cough?
Yeah, there is some time. There is.
What type of noisy breathing? Is this like wheezy like sound?
I would say, doctor, this mostly it is a chesty cough. There's some coarsey sound, but in between, when she become okay, there is some time there is, but it is not too frequent like wheezy sound.
Okay, all right. Just want to make sure that the cough is not continuously and then followed by vomiting. Is it? It's not like that, right?
Yes, doctor, it's
Not
right.
like that. Okay. And tell me about the fever. What type of fever? Is it low grade or high grade?
Doctor, it is I measure most of the time it remaining between 38 to 39 degrees.
Okay, it's quite a lot. Is that all the time of the day or it's like often on?
Yeah, doctor, I notice it is remaining almost all of the time. Whenever I'm giving some this any fever medication, then it settled down a little bit, but
Um,
it again it came back.
all right. Does it associated with any sweating or any chills and rigor?
There is, I notice sometimes there is sweating in his forehead area, but there is no rigor.
Okay, all right. And you mentioned about shortness of breath. Can you describe a bit more for me? Why do you think shortness of breath? Is it because her chest has been second in during the breathing, or is this because he looked breathless?
Yes, doctor, you're right. Whenever she's coughing too much, then I notice there is some like this similar chest going to be retracted sometime, but not all the time.
Okay, all right. Do you think that this cough and fever and shortness of breath has been worsened throughout the day, or it's like the same since the start?
I would say, doctor, it is progressing actually. Now it is, unless I didn't make him some treatment. I didn't went to GP like this time. I went to GP and he referred me to you because he has been also seeing for the last 6 months. So he said better to have a means go through your OPD. So that is why I'm here.
That's a good decision that you made. I can see you're quite caring father. Can I just ask another question? Do you notice any change in terms of her weight?
Uh, Change in terms of her age.
Weight? Does she lose
Yeah,
weight?
yes, doctor. I just noticed her. She's losing her weight.
How approximately, how do you notice that?
Doctor, I just noticed that the clothes which she was wearing is becoming loose.
All right, okay. And when did you start notice that she has been, her clothes has been loose?
Doctor, I think I don't exactly remember, but since he's having this condition, think maybe about 6 months or maybe more.
6 months or more, you noticed. What about appetite? Is her appetite good?
Yeah, because of the sickness, he's a better diet. Also, she's not taking proper diet as she has been taking before.
Okay, can see that. And does she ever complain about any awareness of the heartbeat?
Yes, doctor. Whenever there is fever, there is fast heartbeat.
When did she complain about these fast heartbeats?
When there is fever.
When she has a fever.
Yeah.
Okay, all right. And does she ever has a loss of consciousness?
No.
Okay, any chest pain she complained about? Any back pain?
Mm, No, doctor, but she's become quite distressed whenever it happened continuously. Then she become more discomfort.
Okay. And what about lying down? Can she feel more breathless when she lie down?
Yes, doctor, it is your truly said. Yes, there is. When she
Is there
lie down,
any
she's.
is there any
Hmm?
particular side that make her more breathless? For example, lying on left side or right side make her more breathless, or it's like lying flat on the back?
No, no, I didn't notice this thing. I didn't notice. Really sorry, doctor.
Okay, no problem. Do you notice any swelling of the legs or any swelling of the body?
No, he is actually losing his. He's very skinny, becoming very skinny.
Okay, I can see. All right. Um, and do you notice any frequent history of any ear infections or ear pain?
No, doctor, there is nothing such thing.
Okay, any nasal discharge, any runny nose?
Sometimes, as whenever there is change in the weather, then she exhibiting this condition. Otherwise, no.
Okay, all right. And any concern with the tummy, any tummy swelling?
Uh, Tummy actually he's losing his weight. He's having some also horrible diarrhea. She's having about she's passing 7 to 9 times in loose motion and very bad smell. And it is also difficult to flush.
I'm sorry to hear that. It looked quite a lot for her. Do you
Mm,
notice any swelling of the tummy along with these loose stools or his tummy is flat?
no, doctor, I didn't notice this thing.
You mentioned that this diarrhea. How long she has been having this diarrhea for? When did you start notice that?
Since the same time, I just noticed maybe if his cup shortage rate started 6 months, then maybe it is for 4 months or 5 months he's having this condition.
Okay, you mentioned it's difficult to flush. It's quite offensive. Do you notice any blood mucus there?
No, I didn't notice it, doctor.
And when was the last time she has this loose motion?
Sorry,
When was the last time she has this loose motion?
doctor. She has been passing 7 to 9 times a day, every day.
Every day.
Mm.
You mean every day? Sorry.
Yes, every day, nearly 7 to 9 times per day.
It's been for 4 to 6 months. All right, I can see. Anything in particular make this loose to worse or anything in particular make it better?
9 minutes. No, doctor, I don't think because only the GP is giving sometime antidiarrheal medication, then it become a little bit better. But again, mm,
Okay. All right. Do you notice any yellow color of the skin?
No, doctor, I didn't notice.
Any pain in the body, like any joint pain?
Yes, she is complaining of joint pains. There is all over, even she is telling his pain all over the body. Even if when I try to hug her, she's feeling there is pain.
Okay. Any swellings in the body, like any swelling in the neck or any part of the body?
No, doctor.
Okay, all right. In terms of the past medical history, you mentioned she has been having this pneumonia for 5 times, and was it all this time require admission to hospital?
Yes, doctor. This is quite
When
several
was the
times.
last time? When was the last time she was admitted?
I think it is last time she was admitted 3 months or 2 months before. Yes,
How was she treated at that time? Was she require any intravenous medications?
the last time when she was so much breathless that she was admitted in the ICU, and even the CPAP was given to her.
Okay. And any intravenous antibiotic, did you remember any medication through the veins given?
I don't remember the medication, but doctor, you are right. There are a lot of medication they are giving her by this blood tubes.
Okay, all right. Is she under care of any doctors at the moment?
Yeah, the chest doctor is been seeing her, and actually till now we still not didn't able to find out what is the so some mostly the GP is the one following.
Okay. Is she under any regular medications?
Not any medication.
Or any allergy to anything?
No, doctor.
Any recent history of traveling?
No, doctor. We cannot afford the traveling.
Or sorry to hear that. What about family history? Any family member has any problem with Lens disease or any heart problems?
No, doctor.
Okay. And is anyone smoke around children?
No.
And can I ask about birth history? How was Sarah born?
Yeah, Sarah was born normal delivery and it was quite okay.
Okay. And can she pass the poo within 48 hours after birth?
Yeah, she passed. So,
And what about 5 day hip ring test? And they did a spot test at day 5. Was it normal?
it was done, doctor, but I don't remember the test result because
Oh no.
because we are also new in this area.
Okay,
So
no
because it
problem.
was done in the my previous area, so I was
Okay.
not able to follow the result.
All right, no problem. That's fine. And in terms of the finance and psych and then social, how is Sarah condition affect the family members?
Really, doctor, because being a child with this condition and to keep running in the hospitals, and it's become very difficult to manage at home as well as I'm not able to see my child in this condition.
I can see that it must be quite stressful for you. Is Sarah, do you have any concerns with her Sarah development? Like, can she develop in like other children of her age?
Mm, I just noticed that she's okay. She's in terms of walking, talking, and socializing. But I say it takes time to adopt for any change. And any change, she takes time. Otherwise, she is okay with as compared to 30 minutes finish. Now you
Okay,
can present your case.
all right. Today, I took the history from Mr. Ali, who is the father of Sarah. Sarah is a 4 years old child presented with cough, fever, shortness of breath for 4 or 5 days durations. Cough is a chesty cough associated with shortness of breath, and there isn't any noisy breathing like wheezy or stridor I've noticed. Fever is a high grade 38, 39 degrees Celsius, responsive to the antibiotic medication associated with night sweat. Sarah's has a history of weight loss for 6 months durations and also have loose stool for 4 or 5 months durations with a bit of smelly, offensive in nature, is difficult to flush the bowel. She has a past medical history of frequent admission for pneumonias, and the last time she required intensive care admission, requiring medications to the intravenous medications. There isn't any family history of asthma or other chronic lung disease, and Sarah was born normally and does not have any postnatal problem afterwards. So I would like to, if I have time, I would like to explore more about immunization history. So based on my history, I believe this is a 4 years old child with recurrence and history of cough, fever, shortness of breath. My provisional diagnosis that it could be chronic lung disease, because either bronchiectasis or cystic fibrosis. And it can be related to any immune deficiency, either primary immune deficiency or secondary immune deficiency.
Okay. So first, before going to the this, I would ask you. Means you said me that there is family history of similar condition of. So I didn't told you anything such. So this is something any called. Any you are taking something which is not told to you. I
I
didn't
asked you
mention.
that is there any family history of any lung disease or any problems? You mentioned that no.
Yeah, I said no. Ah, you
Yeah,
said you said no. Okay, okay. So I thought you said there is a family history of. Yeah.
no, I said that there isn't any family history of
Okay,
any
okay.
lung problem.
Why are you keeping the bronchitic cases in the first of in your first line of your differential diagnosis?
Because of the recurrent cough with fever, recurrent history of chest infection, which is chesty in nature, along with weight loss. And
Mhm,
but my first differential is cystic fibrosis. Second is bronchiectasis. Yeah.
mhm. So okay, I will make a review in the later on. Okay, I will not comment now. So how I am just proceeding the way of examination. So after this, what you will do for this patient?
I would like to admit the child, and I would like to do the proper. I would like to do the proper thorough history and then examinations. Do the proper vital sign. I would like to do the blood pressure, temperature recheck, and I would like to do the basis blood test to rule out any features of to rule out any increased inflammatory markers in the bodies. And if needed, I would like to review the past
You
hospital.
told me that you will like to do this examination. Which examination you want to do?
I would like to specifically focus on respiratory examinations. But if I
Mhm,
have time, I would like to focus on other examinations, general examinations, because the child also have abdominal symptoms as well as some musculoskeletal symptom as well.
mhm. So based on your history and your physical examination, what investigation you would like to do?
First of all, I would like to do with the routine blood test, full blood count, CRP, ESR, liver function, renal function, and I will review the past admission notes about the sputum results, and if there is any growth of any germs, I will discuss with my senior for the recheck sputum sample for microculture and microscopy. And also, I will do based on my finding. If I've noticed any consolidation focal features, I would probably think about doing the chest X-ray. If the child has not done any CT scan, I would probably think about it. And I will also review the note in the past about cystic fibrosis screening, whether this test has been positive or not. If not, I'll probably arrange for the cystic fibrosis screening test. Because of the chronic diarrhea, I would arrange for stool microscopy and culture as well.
So you said to me that you will admit the child. So where you will admit the child? In ICU, ward, or where?
So that depend on the child oxygen saturations and then general condition. If child can self-ventilating in air without requiring oxygen, I would like to admit in the cubicles, because until I have got any swab and the culture results came back negative.
Mhm. That's fine. Okay, and okay, after this, doing all this examination and investigation. So, what do you think? What you will find in your, for example, in the lab finding?
That depend on the cause as well. If it is a cystic fibrosis, I may find the features of metabolic hypokalemic, bonatremic, metabolic alkalosis features. I would also have a do the sweat test, and I will see the sodium level. in the sweat of more than
you said hyperchloremic metabolic alkalosis.
yeah
Why it is like that?
hyponatremic
Hy-
hyponatremic hypochloremic metabolic alkalosis.
Why is it something associated with cystic fibrosis?
Because cystic
Okay,
fibrosis loses sodium and chloride in the body.
okay, it is not like that. Just I will correct you. It is not. It is the feature. It is the feature of suppose any like in case of I think RTA, renal acidosis, it can be similar to metabolic, but it is acidosis, not alkalosis. In hyperemesis, it is hypochloremic metabolic alkalosis can be there in, if there is any severe emesis. But cystic fibrosis is having nothing like that. Okay,
Okay.
and yeah, because it is not mentioned in the even the guideline. And anyway, خلاص, this is the you told me the labs. Okay, this then X-ray radiology you said told me. Okay, what do you think about the if there is abdominal? What is the condition which you make to think that if there is abdominal pain and if the case is cystic fibrosis?
Pardon, what is your question? Sorry.
And if you are thinking that it is a cystic fibrosis and patient is presenting to you with abdominal pain, so
All right.
what should it come into your mind?
Okay. So, differential diagnosis of abdominal pain, cystic fibrosis, either it could be paralytic meconium ileus, and it can be because of the constipation. It can be pancreatitis causing the pain.
Meconium is, remember, it happens in the early life, in the childhood age, even in the like the afterbirth meconium. Uh, but like mostly associated condition is intussusception, volvulus, appendicitis. That's right. Even hepatitis, pancreatitis can be. Okay, and okay, what are the pulmonary complication of the cystic fibrosis?
Sorry, what did you say?
What is the pulmonary complication of the cystic fibrosis?
And acute exacerbations of Lyme disease, infective exacerbation of the Lyme disease, allergic bronchopulmonary, allergic bronchopulmonary aspergillosis can happen, and also asthma can present in cystic fibrosis.
Mm. So, what do you think? Cystic fibrosis is which it is a contagious disease, or what is reason why this disease is so much causing so frequent, and it is involving not only the chest, it involving the abdomen also, and even like it involving the reproductive system also. What do you think? It is. Did you get my question?
Oh, no, sorry.
This cystic fibrosis, is it a sporadic, epidemic, bacteria, viral? What?
It's an autosomal recessive disorder affecting the MATI system because of the problem with the sodium secretions. This can cause insipated secretion inside the organ, mostly in the lungs and also intra-abdominal organs. So it can cause problem with chronic lungs, recurrent chest infections. It can cause problem with the hormone productions in the pancreas, also cause a problem with the intestine or malabsorptions, and it can cause infertility problems in women.
Mhm. So you said, sorry, I'm just going back to check some information regarding you said you will do the full blood count. Why you were doing the full blood count? What you like to see in the full blood count?
Because it can associated with malabsorption, so I might expect to see any features of anemia,
Which
or
type of anemia?
it can be in case of iron deficiency, it can be microcytic hypochromic anemia, or if it is
Mm-hmm.
B12 deficiency, it could be macrocytic anemia.
Good. And if it is continuous chronic condition, even the normocytic can be condition also. Okay, you mentioned that you will admit in the cubicle, okay, and you said me that you will do the airway breathing circulation. Did you mention that you will do hydration status and about his bronchodilator or something like that? Did you mention all
No,
that?
I haven't go to the management parts. I have done only the investigation parts, but you asked me the other
Okay,
questions
okay, okay,
before.
okay. No, 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 no. Okay, now I am giving you the chance. Go for the management part.
Okay, so for the management parts, I will involve multidisciplinary teams, which involve consultant pediatricians and also the cystic fibrosis teams, physiotherapics, and respiration specialist nurse, and also social worker. If also lies family members with the social psychological supports, because parent has been very frustrated with her recurrent symptoms and going on with that, and then admit in a strict cubicle rooms and then start with IV antibiotics for the acute infections.
Which
Uh,
antibiotic you will start?
I think I need to read through the guideline. I'm not quite sure about that.
Okay. Then, okay, next.
Yeah, and um, in order to start the nebulized medication, if the child has not been diagnosed with cystic fibrosis, if it is the newly diagnosed cystic fibrosis, I would
Mhm,
probably liaise with the cystic fibrosis team and discuss with cystic fibrosis teams what type of medication to start, and what type of prophylactic medication child requires in long term, or whether nebulized medication require or not.
mhm. Okay, just I will add you
Involve
that.
dietitian. Yeah.
mm, yeah, you are right. Just regarding antibiotic, if the case is newly diagnosed, then if in I'm telling it is diagnosed but not in exacerbation, okay, then you will start flucloxacillin 125 milligram per oral BID until 2 years of age. But if
Sorry, sorry. If newly diagnosed,
and not in exacerbation,
not exacerbations.
yes, then you will start with flucloxacillin 125 milligram per oral BID till 2 year of age. But if the child is coming with exacerbation, then you will start cefuroxime IV for 2 weeks, okay, and then subsequent treatment depending upon the antibiotic sensitivity, okay. And what type of inhaler do you think to should be given to this patient?
Hypertonic salines or DNAs, or if there is a asthma ongoing, if there is wheezing or bronchospasm, I would probably think about bronchodilator or steroid inhaler.
Mm, okay, because she we have actually this division. I will come to the later on. Okay, let's tell me the sputum. If the sputum is green color, what do you think?
Pseudomonas infections, most
If it is
likely.
black, if it is black color,
Haemophilus influenza
no.
or
Black color, as
streptococcus pneumoniae.
no. Aspergillosis in black color.
Aspergillosis in black colors. Okay.
Yes. And if it is dusky color,
Haemophilus influenza.
no. Burkholderia.
Bacudella.
Yes.
Bacudella is a dusky color. Black
Yes.
color is aspergillosis, and then
Yes.
green color is pseudomonas.
Yes, you're right. So, okay, if when you will be saying the patient is colonized with certain bacteria.
After getting the culture and sensitivity results, and also if the child has already been diagnosed and admitted last time, and then receive antibiotic, I will review the culture results of that last time, and I will give antibiotic from the based from that admissions.
No, doctor, my question is when you will be saying that the patient is colonized with certain bacteria.
Uh, Colonized with certain bacteria. If it is more than 50% organism in culture sample,
For
I don't
for
know.
last 12 months, minimum 4 samples.
For last
For
12 months,
minimum 4 samples. If you have for the last 12 months and 4 samples are showing 50% of the same colony bacteria, then you will be label the patient as colonized for that bacteria. Okay,
that is chronic infections, right?
exactly.
That's
Actually,
the meaning of the chronic infections, right?
yes, because we
Or
have been dividing.
colonization.
Yeah, because there is it is why we are discussing, because it is important in the term of management. Like suppose if a patient coming to you, for example, let's say if it is a coming and you did the uh, this sputum culture and become positive for pseudomonas, but patient is not symptomatic. So what you will be doing? What the line of action? What antibiotic you will be doing?
Sorry, I think that my line is interrupted. Can you